we go to Tanzania, where President Samia Suluhu this week took the Covid-19 vaccine in a signifying moment for the official vaccine rollout in that country. This was a remarkable departure from the stance taken by her predecessor, John Magufuli, who was a prominent coronavirus skeptic and did not believe in vaccines. Suluhu has urged all Tanzanians to get vaccinated, saying the country was not an island. The country has applied to join the global COVAX vaccine distribution scheme and received a batch of 1 million doses of Johnson & Johnson vaccine donated by the U.S. government on the 24th of July. Is this a milestone for Tanzania, or will the decision further alleviate and alienate more people? To get a sense of how people have reacted to this transition and development is Tanzanian journalist Samia Suluhu. Samia, a very good morning to you. Thank you so much for joining us. Of course, this is a huge turning point, one would assume, especially looking back at the former president, predecessor John Magufuli, who took a completely different stance when it comes to COVID-19, in complete denial. What does the president's move signify going forward for Tanzanians?
Yeah, you said it right there, that this is a huge U-turn from the past administration, which was just about 4 months ago. President Magufuli was well known for being for taking very controversial policy regarding COVID-19. At the beginning of the pandemic, in the first 3 months, he tried to follow science, but then from there, that was last year in June, up to when he died, he took a very controversial policy regarding coronavirus. He said, he tested fruits and goats and birds, and they all tested positive. He didn't want to impose any kind of measures. And then towards the end of his administration, he also questioned the efficacy of the vaccine. He warned people not to rush towards it, and saying that vaccines elsewhere have had a lot of problems. He gave examples of countries or cases where people took vaccines and they had very bad reaction to it. So he warned people, and the Ministry of Health went ahead to say that the country will not order any vaccines. Now, 4 months later, we see President Samia, taking a very different turn. It was, in fact, one of the first policy that she changed completely from President Magufuli. And immediately after she took power, she formed this commission to say, investigate this and then tell us what should we do. And so the results of that commission's report was that the commission advised the government to take a different turn, to start announcing numbers, and including taking vaccines. And that's why now we are seeing now the country has just received 1 million doses of vaccines from the U.S. This is Johnson & Johnson. And the president, like you said, took a jab a couple of days ago to signify that this vaccine is safe, contrary to what her predecessor had preached for a long time. But there are a lot of challenges around that.
Now, President Samia has made this move as a show of confidence, as you make mention of. But how has this been received when it comes to the general attitude of Tanzanians? Because under President John Magufuli, he even went as far as mocking those who wore masks. But when it comes to the seriousness and perhaps a show of confidence of President Samia, how have ordinary Tanzanians reacted?
The ordinary Tanzanians are very divided on this one. There are so many people who do not believe that the vaccines are safe or they can actually make any difference. In fact, I've been speaking with even some doctors, and these are people you would think, they have better understanding of how this vaccine works. But even themselves, have questioned the efficacy of this. Even within her own party, Chama cha Mapinduzi, the ruling party, we have this, they have one member of parliament who is a bishop with thousands of members. I think was it this week or the other week, he preached, to his members, telling them do not take vaccine. He mixed in all kind of, controversial religious conspiracy theories, telling them if you get this, you will die, you will do this. And this is the bishop with thousands of members and many others outside the church, who follow him and believes what he said. And he repeated again this midweek. And so there's a lot of these very confusing and scary conspiracy theories being thrown around, even from members of her own party. Now, the public as well. President Magufuli, was regarded as a populist. There were so many people who believed in what he said. They followed him. They loved, his leadership style. There were so many people who loved him. Now, because of what he said when he was alive, and this is just, a few months ago, people still cling on to what he said. They say, we believed him. He was the president. There's no way he didn't know this. And we believed he had best interest to us. And so there's a lot of reluctancy, from ordinary Tanzanian to taking these vaccines. And that is going to be very difficult for this government to convince them, especially as well because, while the president has tried to change the policy, you still have, for instance, ministers, the minister and the deputy health ministers who were in the past administration. And these are the people who really campaigned for herbal medicine, also in one or another questioned their efficacy. They didn't instill that confidence that was needed, especially coming from the health ministers. These are the people who are still in that docket. And there are so many other government officials who haven't, questioned the vaccines before, and they're still around now. So there is a lot of confusion there, and many Tanzanians are hesitant to taking this vaccine.
You make mention of President Suluhu Hassan's cabinet and the many mixed reactions there, and also making mention of Health Minister Dorothy Gwajima, who had, before this, advocated for home remedies, also taking a shift. Is that also perhaps some confidence that she's inspiring to ordinary Tanzanians when it comes to now taking the virus seriously? Because as far as the data is concerned, what's being reported is that there are around 100 cases and 70 of those people are in hospital or in need of urgent medical care. Is that also something that perhaps is giving the Tanzanians on the ground some sort of a reality check when it comes to the seriousness of the virus?
It seems that hasn't been enough, because we're still hearing, very, this hesitant reaction from ordinary Tanzania, even though she took the job, together with the president the same day. But still people are hesitant. Because they say it can be just within 4 months you have already changed your mind. I mean, some people are saying, how can we know that what you've taken is also going to be administered to us as well. What if you've taken something else? Some people are even saying, like, what if you've taken water? So there's a lot of hesitance really around that. And that's because they've had this person for so long taking very, controversial stance. And all of a sudden, just because there's a change of administration, she has also changed. So there's a lot of hesitance around that as well. And even what the government is saying, for instance, in public about what is happening in hospitals and elsewhere, people come with different narratives, people come with different experiences from there. And so still that seems not have worked quite well. And there will be a lot of there will be a lot of challenges really to convince the government. But the government is trying. I've seen a lot of campaigns from the Ministry of Health. There's been also some kind of rallying behind editors and journalists to really try to tell them, yes, we've had a long time of denying the efficacy of the vaccines, but now it's time to really try and convince the public that this thing is safe.
And of course, in your drive as the media as well as government trying to encourage residents to indeed take the vaccine so that the country can achieve herd immunity as reported by the president, what are the main challenges when it comes to perhaps communicating the message and changing perceptions in Tanzania?
Well, the challenge, first of all, is the medium of reaching out to these people, because President Magufuli was known of touring the country so much. He did travel outside that much, but he traveled within the country so much, and so he reached to so many people. And when he traveled to these places, he didn't just address those people he met there, but also his address was live. For instance, on social media, and the main television channel, something which the current president is not doing much. So while the controversial message before reached to so many people, the new message is not reaching as many people, as the government would want to reach. And so that's one of the major challenges. But also, President Magufuli was a different leader. And he died sort of while he still has so many supporters. And so there are still people, even though they have a president who is part of the ruling party, but there's still many people who still, supported President Magufuli. And so even though they want to support the current president, but the message and the person who told them that, they still support the message and the person who told them that, be careful with these vaccines. But also even the media itself. There are so many journalists as well within the media who are also, not too sure about the vaccines. So it's not just the channel, but also even the messengers. Like I said before, I've had hundreds of doctors who are also not sure. So if you have the messengers and the medium, not enough to take that new message, it's still going to be very difficult. And that is going to be a challenge for a long time. And some people say, well, maybe we'll have to wait, for a few weeks or a few months to see if there is anyone who has, got any side effects, and then we can measure from there whether we want to take the vaccine or not. And so it's going to take a little bit long time for more people to gain that confidence. Maybe after they've seen, their friends or family member have taken, the jab, and then they see there isn't any bad side effects. Maybe that's when people will start taking the jab. But at the moment, it's going to be very difficult for government to convince people. And this is because of what happened in the last administration.
President Suluhu Hassan told journalists that, according to her data and records, there are 100 people who are known to have COVID-19 in Tanzania, with 70 of them on oxygen, needing oxygen tanks. But as we explore those dynamics around the numbers, there's still uncertainty on the exact accuracy of those numbers. But upon observation, Sammy, as a journalist, perhaps interacting with hospital staff and trying to assess the manner in which nurses and those on the ground in hospitals are managing those patients, what are some of the observations that you've seen there? Could the number really be much higher?
That as well has been very difficult to establish. I mean, everything about so there's so many things about the last administration regarding coronavirus, which, I mean, the legacy that the last president left really bad when it comes to coronavirus, because as journalists, we cannot get any forms of confirmation from doctors or other health workers in the hospital. They are still so much afraid of sharing any information, lest the government punish them for contradicting its stance. I mean, even the president herself, a few weeks ago, when she visited a local hospital here, she went to a ward which she didn't know that it was for COVID-19 patients, until she asked the doctor, like, who was staying here, and the doctor told her these are people who have difficulties in breathing. Now, this is the term that the last, was quite predominant in the last administration, because even saying COVID in the last administration was problematic, So people found all these ways, things like pneumonia or difficulty in breathing. So even the president, even the doctor could not, did not have the confidence to tell the president that these are COVID people, until the president asked him, are these COVID patients? And he said, yes, these are COVID patients. And so it's still very difficult even for doctors to give, those, or to come up openly and talk about what really is happening on the ground. But apart from that, we see as well these numbers that the government is announcing. If you go to, for instance, the WHO's website, you don't see these numbers being even, carried or being updated as the government update them. But we also know that because of how the government handled coronavirus in the last administration, there are so many people who just, don't bother to go to the hospital anymore. Because even if when you go, it won't be, the way the health cares and the health centers are treating this, this COVID is very problematic as well. So it's just difficult to prove any of these data that the government is telling us. The health workers, the attitude is very different now. People are not quite open about it, and so many people are being treated at home, and there are a lot of people probably who are dying at home, but there's no way of us proving that. So that is a challenge as well, to really confirm what are the actual numbers of those in hospitals, but also those who are suffering at home.
Absolutely. Thank you so much for your time and giving us some insight on what's happening on the ground in Tanzania when it comes to COVID-19.